very good evening to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be doing really good. Today we are here to discuss a very important topic which is related with our skin, and the topic that we are going to dive in is acne management. Now I'm sure most of us has gone through that phase of acne and how difficult it is. And I often say that acne is just not an appearance related or surface related issue. Deep down it affects our self-esteem, our mental health. Many a times people go into depression just because in case we have acne, then what to do? Because it's very important to treat it by the right person at the very right time. And for that, today we have this session with a very renowned skin expert from Delhi, Dr. Veenu Jindal. Now, before she joins us, let me introduce her to you all. Dr. Veenu Jindal is a highly qualified MD specializing in dermatology, venerology, and leprology with extensive experience in this field. She also serves as a cosmetic dermatologist and hair transplant surgeon, demonstrating a specialized focus on aesthetic treatments related to dermatological care. She is committed to providing the best possible care to her patients. Dr. Jindal keeps her knowledge up to date by staying abreast with the latest advancements in dermatology. Patients can trust her to provide effective solutions to a wide range of skin-related problems. Dr. Jindal's compassionate approach is evident in her personalized attention to each patient and her clear communication of treatment options. She regularly attends conferences, training sessions to incorporate the latest research that is going on. And here we go. We have with us Dr. Veenu Jindal. A very warm welcome to you, Doctor.
Hi, thank you for having me here.
So, Doctor, it's such a pleasure to have you with us. And today, we are diving into such an important conversation because it is about acne. And as we all know, acne is such a chronic, skin condition.
Yes.
And many a times people go into depression just because they have this chronic skin condition called acne. To start with, Doctor, what is acne? How to deal with it? But before that, what is acne? Why it happens?
Right. So acne, as we all know, is a very, very common skin condition and it affects a lot of teenagers. It is so common that out of 10, every 8 people will have acne problem once in their lifetime or so. The most common cause for acne is basically we have oil glands on our faces and they have a duct. That duct gets blocked with your extra dead skin or excess oil production, and this blockage leads to blockage of the pores that forms in acne causation.
Right. So,
So basically, in
blockage of
simple
those
words, blockage of your pores leads to acne.
acne. Right. And what are the various types and grades of acne, doctor? Because many times we see, very small bumps, just like what we call as lemon blackhead, whitehead.
Right.
But then sometimes it's so severe, like pus fill and really painful.
Right. So acne can broadly be classified into 2 types. One is non-inflammatory, the other is an inflammatory type. Non-inflammatory will have your blackheads, your whiteheads, and the inflammatory will have the papules, the pustules, the nodules, and the cysts. So in general terms, the non-inflammatory means that the body is not showing any sign of inflammation. It is just the blockage of the pore. Whereas in inflammatory acne, the body has started showing some sort of immune response. It has started sending in a lot of mast cells and all of those inflammatory proliferators, which leads to those red, painful, and more severe category of acne. So broadly speaking, non-inflammatory, inflammatory, non-inflammatory has blackheads, whiteheads, and inflammatory is papules, pustules. And when I talk about the what do you call the severity can be mild, moderate, severe, and very severe. Who has just mild acne will have majorly whiteheads, blackheads, very few papules. A patient who will have moderate acne will have more number of papules but very few pustules. Whereas when it comes to severe acne, the patient will also start showing nodules along with pustules and papules. And very severe acne will have majorly cystic and nodular acne. That grade is the most severe grade of acne.
The more severe is the grade, the more scars it can leave. Is that
Yes,
true?
yes, yes, yes. So the more severe the acne, the higher the inflammation, and higher the inflammation means the body is showing a lot of response to it, like basically immunogenic response, which leads to higher amount of scarring and post acne sequelae. So as we all know that acne in any which way heals on its own, but we are afraid of the scarring, and that's why we want to start the treatment at an early date.
Right. That's it.
Yeah.
It becomes even more important to go and take advice from the right person, which is a qualified dermatologist. But in our society, doctor, and I'm sure you'll also agree with me, because it's so easily, it's so accessible. The chemist shops I'm talking about, people just go. I'm having these pimples. Please suggest something. They'll suggest as a cream, and we'll start using and keep on using it until and unless we realizes that acne is one thing, but then our skin is getting addicted to that cream,
Right.
or we are having other issues like facial hairs, etc.
Right.
So my question to you is, doctor, why it is important to not go for these over-the-counter topical applications? How harmful they can be?
So see, OTC, over the counter medicines, are not particularly bad. You mentioned increased growth of hair and skin addiction. That does not happen with any anti acne medicine. That is a common side effect of steroid abuse. And a
Hmm.
dermatologist will not prescribe a steroid unless and until absolutely necessary for a condition. Whereas
Hmm.
commonly, the most common thing that I've heard, like growing up, is a betnovate cream. Even a facial
Hmm.
parlor auntie would suggest कि आपको ये redness ना आए तो आप betnovate लगा लो. So it has been
Right.
commonly misabused and abused and misused over the years, and that leads to addiction. But OTC medicines, when you're talking about a proper consultation with a dermatologist, the first step in the consultation is to figure out the cause. If we can find the specific triggers of the cause, then we can give patient a long term treatment plan, and we can educate the patient in a manner wherein they can have sustained results. Otherwise, if you start using a topical, for example, your friend is using something and you copy paste the same thing, it may or may not work for you, but then it'll stop showing response the moment you stop the medicines. So for a longer
Right.
lasting result, you need to meet a dermatologist at least before you start any treatment.
Right. And also, because we are so obsessed with home remedies or quick fixes and or DIYs, which are so much in trend these days. So we love applying something on our skin, on our acne, starting from
Right.
toothpaste to garlic to whatnot. So are they fruitful? They are
No.
useful of any use, or
No.
they can be harmful as well?
They should only be all these garlic, the lemon juice, the tomatoes, they should only be kept to the kitchen. All of these things may cause an entity known as a phytodermatitis, meaning that even plant-based products, when they're not formulated in a manner which suits your skin, can give rise to a rash. Plus, when you scrub your face too harshly, when you have acne prone skin, you are transferring the bacteria all over. That can lead to increase in your acne. And there are items like toothpastes which can cause burn of your skin and can give you a very bad scarring and a pigmentation. So all the home
Okay.
remedies, if you have a very naturally like a healthy skin, then you can try a few safer items like honey or oatmeal. But if you have acne prone skin, do not touch, do not try to do anything fancy. Just simple medicines will show you the results.
Right. So in case you have acne, please go to the doctor at the initial stage, and
Right.
you'll that will save yourself from having those really big painful acne and the scars after those acne get healed.
Right.
Now, doctor, again, we have so many influencers on various social media platforms, and of course. Most of them talk about skin related issues. Acne is one of their favorite subjects, but then most of them are not qualified dermatologists. They
Right.
just, give DIYs and etc. etc. And market does is flooded with products and DIYs. So, of course, using 50 products or 10 products on a regular basis is not possible. But this is the reality of today. We are experimenting a lot in terms of product or skincare. So, my question, I mean, they are in two parts. A, do these experiments or, experimenting with products, buying one product 1 month, buying the other in the second month,
Right.
do they really work, or they can also cause more of acne if we have a sensitive or acne prone skin?
So sadly, we are living in times when there is too much noise on social media, right? Every day there is new product which will be marketed to your face, and it will be marketed so well that you would want to go ahead and try that product. But my advice to all the patients that I see is that cut down all the noise. Start with very few simple, recommended dermatological recommended products. Give them at least 6 weeks before you label them as effective or ineffective, and you also simultaneously keep doing a lifestyle change. And then slowly you can, once you achieve a higher skin health, a better skin health, then you can experiment with more molecules. But when you have a disease or an active condition, just focus on treating that condition and getting it under control. So try to limit the noise through social media. Do not try too many products. You end up wasting your money, and you also may end up damaging your skin further.
Right.
The second
Very,
question
easy
was,
approach that we see.
right.
Yeah, and yeah, that was the question, of course. And also that then what could be a basic minimalistic skincare routine that we all can follow, especially those who have acne prone or oily skin, doctor?
Right. See, if you have acne, like active acne, then it needs to be graded. We first categorize you as a mild, moderate, severe, and depending on the stage of the acne, a dermatologist will prescribe you a list of topical creams as well as oral medicines if needed. So the topical ingredients that are very effective in acne are AHA, BHAs. I think you might have heard of them. Salicylic acid, glycolic acid, then azelaic
Hmm.
acid, then medicines such as clindamycin, benzoyl peroxide, and our cult favorite, the retinols. Right. So this is the most basic list of ingredients which are known to work for everybody. And if you have active acne in the stage of a papule or a pustule, then we also try to recommend an oral antibiotic or an oral retinoid to prevent scarring at a later date. So if somebody has acne prone skin, their skincare routine needs to be very simple. It needs to have a cleanser which can have glycolic acid or a salicylic acid. A toner simultaneously not needed. I usually recommend a hack to my patients. For example, if you were to leave your cleanser for a minute on your skin, a cleanser which has glycolic salicylic, it will in itself work like a toner. So you don't need a separate toner in your skincare routine. So simple cleanser with these ingredients. Then next step has to be your actives which will help in controlling the acne. For example, a clindamycin gel, an azelaic acid, or a BHA, that is a salicylic acid. Over that you layer a moisturizer depending on your skin type. So if you are somebody who has oily skin, then you can go for gel based moisturizer. And if you're somebody who has sensitive skin to dry skin, then you can choose a more creamier moisturizer. And on top of that, you do a sunscreen. So very simple 4-step routine, which is cleanser followed by your actives, followed by moisturizer, and then the sunscreen.
Right. Now, talking about the cleanser, because people who have oily skin or acne prone skin, they feel that, it's just because they have a dirty face or, excess of oil. They keep on washing their face again and again. Is it okay to do practice, or we need to limit the use of cleanser?
Okay, yes. So this is a very common practice wherein a patient, will try to keep on repeating the face washes to remove the dirt and to remove the
Right.
oil. But then what happens
Oil.
is when you over cleanse, you send your body a signal that your skin is dry. And in response, your body will produce even more oil. And that leads to further blocking of more pores. So eventually you are doing more harm than good. And as a thumb rule, I suggest my patients to use a face wash only twice to thrice in a day. And if they're feeling too heavy on the skin, then they can just splash water. But
Hmm.
skip the cleanser and do not use it for more than twice or thrice in a day. And also one very helpful tip is that you can have two types of cleanser in your closet. One is a gentle cleanser, which will not dry out your skin, and the other cleanser has AHA, BHA, which will be more therapeutic. So on days when you're feeling that the skin is too dry, too irritated, you can go for a gentle cleanser. And when your skin is feeling oily, for example, this is a monsoon season, so everybody is
Hmm.
complaining of more congestion these days, then you can go for the
Hmm.
harsher cleanser.
Okay. People also love exfoliating, especially those who have acne issues. They feel that this way they can keep the clogs open, etc.
Hmm. Hmm. Scrubs, physical scrubs are a strict no-no in active acne because, as I mentioned earlier, when you scrub too hard, you tend to transfer the bacteria all over. So there is no like, we strictly say no to physical exfoliation. Chemical exfoliation, on the other hand, is a very good idea. So chemical exfoliation means using products such as glycolic acid, salicylic acid. What they do is they loosen your top layer of the skin. The cells are separated so that the dead skin cells get what do you call sloughed off at a faster rate, and your medicines tend to work at a faster and a better rate, and you get faster results. So chemical exfoliation is okay, but physical exfoliation is a no-no.
And for chemical exfoliation, of course, we need to go to a dermat.
No, no,
Right.
no. So as I mentioned, you have products which have 15% glycolic acid for home use.
Hmm.
You don't need to come to a
Okay.
clinic for that. You can also do it at home.
Okay, fair
Yeah,
enough. And
yeah.
after with moisturizer again, because people are so confused, they already have a oily skin, and normally people who have oily or acne prone skin, they skip the moisturizer part because they feel I don't need any moisturizer. But you said that moisturizer is equally important. Why so?
So what happens is when you're doing anti-acne medicines, your barrier, skin barrier can be affected. Like all these anti-acne medicines, they work by reducing the oil production. So it is very important that we restore the skin barrier simultaneously so that you do not have a rash and you do not develop a sensitive skin. So very helpful tip for patients who have oily skin is that they can skip moisturizer in morning and directly apply a sunscreen and rather do a thick layer of moisturizer at night. So that way they do not feel heavy or greasy throughout the day, and they're happier using a moisturizer at night. And again, you
Hmm.
can use a moisturizer according to a skin type. So if you have oily skin, go for a gel based, and if you have a dry skin, then you can choose a creamier moisturizer.
Right. And with sunscreens, people have so many complaints or excuses for not using sunscreen on a regular basis. So, starting from, I don't go out, my exposure under the sun is not that much, or I don't like the dull, patchy appearance that it gives me, or I start sweating after applying sunscreen. So, it goes on and on and on. And probably that is the reason
They don't
69% of people in our country are not yet using
using.
sunscreen on a
Yes.
routine, regular way. So, doctor, why it's so important to use sunscreen on a regular basis, even if
Right.
you have acne problems?
Right. So basically, sunscreen is a chemical which protects you against the UV damage. There are three types of UV: UVA, UVB, and UVC. UVC does not penetrate Earth; it's not bothering us. But UVA are the rays which basically cause aging and causes pigmentation. UVB are the rays which cause skin cancer. So when we are using sunscreen, we are protecting our skin from aging, pigmentation, and also from skin cancer. So it is a must. It is like a no-brainer that you have to use sunscreen every day. Now, thankfully, when it comes to acne-prone skin, we have matte or gel or silicone-based sunscreens available, which not only are elegant, very cosmetically elegant, but they also, sort of give you a clean, smooth like finish, which minimizes the appearance of the pores. So my patients, there are few brands which my patients absolutely love using when they have acne. Even when they have active acne, they love using those sunscreens.
Right. Now, without naming those brands, can you just tell us if I have an acne prone or oily skin,
Right.
what should be the, things that we should go for? Because there's so much of information on the box
Hmm.
containing the
Hmm.
sunscreen. So,
Hmm.
what are the
Hmm.
basics that we should
So
look for?
you should look first is the most important thing that you have to check the SPF. The SPF 50 is a perfect SPF, but on rainy days, you can also go ahead with the SPF 30. Next, check for the PA protection factor. As I had mentioned earlier, SPF stands for the protection afforded against UVB, and PA factor is the protection level against UVA. So both of them are equally important. That's why we say that read the label broad spectrum. So SPF 50 and PA protection at least 3 plus, 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 plus. Then if you sweat a lot, then you should go for a water resistant sunscreen. And otherwise, just read that the sunscreen should be non-comedogenic and hypoallergenic.
Okay. And doctor, about the application, how much to apply, when to apply, and when to reapply, and why reapplying is so important in case of
Right.
sunscreens.
Right. So if it is a gel-based sunscreen, then 2 fingertip units is sufficient to cover your face, the neck, and the back of the neck and ears. If it is a liquid based or a water based sunscreen, then approximately 2.5 ml, like that much is like a size of a coin, is enough to cover your face and the neck, right? Reapplication, if it is a water resistant sunscreen, then you don't need reapplication as such, unless and until you're out in the sun and you tend to sweat a lot. Then you can reapply every 3 to 4 hours. And if you're sitting indoors the entire day, you've reached your office and then you're indoors, then you don't need to reapply as such.
Okay. Now coming back to our main, topic, which is acne management. When a patient comes to you with acne, are there tests that you normally recommend to diagnose that what might be the cause, or what is the grade, etc., or just by clinical investigation you are sure of it?
Okay, so very good question. We basically see the severity of acne that the patient has. We ask for their medical history first. For example, a patient who will have PCOS will have other signs also, like extra facial hair growth. They will have signs of hair thinning. They might have weight gain problems, and they will give the most frequent history of what you call menstrual irregularities. So if the patient is giving signs of all of those things, then we go for a medical investigation. Otherwise, if a patient is just a teenager and they're just having non-inflammatory acne on the cheeks, then they don't need investigations per se. So it depends upon case to case. If the acne is severe, we would want to go with the investigations to find the root cause. If not, then we can just start with the medical management, see the response. If the patient is not responding, then we subject them to tests. Otherwise, we can carry on like that only.
And doctor, what are the treatment options or procedures available to manage acne as well as post-acne scars?
Okay. So first and foremost, I tell all my patients that there is no shortcut. You have to do medical management at your end. No procedure, however expensive it may be, will give you control, like complete control by itself. So it has to be a combination of medical management and in-clinic procedures. So in-clinic procedures, the most common one is a chemical peel. As we had already discussed, it helps in exfoliating the dead skin and helps in better penetration of the products. A facial, for example, a photofacial or a hydrofacial, these help in maintaining the skin barrier, nourishing, restoring the skin barrier, and restoring the nourishment level of the skin. And when it comes to post acne, like the scarring, then it has to be an entirely different range of procedure depending upon the acne scar severity. So it's a complete different entity that needs to be looked at a different approach. And their lasers, majorly we use lasers when it comes to scar treatment.
Right. For acne scars, of course, as you said, lasers are there. Again, in the treatment or as a maintenance therapy, how important role does these moisturizers or sunscreen? I mean, they are important on a regular basis for that, keeping your skin healthy. But as a maintenance or as a part of the treatment, also, do you suggest these sunscreens and
Yes.
moisturizers?
So acne treatment can be divided into two phases, the active phase and the maintenance phase. And we have to tell the patients that both the phases are equally important. When a patient is in active phase, we might suggest a list of different products to get the acne under control. But once the acne is under control, it is on the patient to maintain the results. Right, because acne is a problem till 25, it will always, keep recurring. But the recurrences can be less severe, they can be easily managed if the patient is doing the compliance phases properly. So in the compliance phase, your cleanser, your moisturizer and sunscreen would continue as the usual. Only the creams, the medicines would go down. So it is equally important to do your skincare routine throughout.
Right. It becomes so difficult when you have acne to keep your hands or your fingers away from your face. Then many of us love, popping or squeezing the acne. And we all know it's not good. Later on, we see the results. So I'll ask you that how important it is to keep our fingers out of our face in case we have acne.
So yes, it is a very common thing. People usually under stress, they have a habit of scratching the face, and specifically the active acne. What happens is that it infects the acne even further. It increases the inflammation, and that leads to acne scarring. So if you want your acne to heal properly in timely manner without leaving a scar, just leave the acne alone. These days, acne patches are available in the market. So I frequently, if a patient has a habit of scratching them, I frequently advise them to use an acne patch on the top of an active acne. It prevents them to, subconsciously touch the face.
Right. Doctor, many times people ask how okay it is to apply makeup in case I have acne.
Huh. So there are a few patients who would say, Doctor, I cannot step out and go to the office with a face full of acne. I do need to use makeup. So right choice of makeup is very important. Go for a light coverage foundation. Do not use very heavy and thick layers of foundation, because that leads to further blockage of the pores. Number two is that you make sure that you clean your tools very, very regularly, because every time you're using a brush or a sponge, it leads to accumulation of bacteria in that particular tool. So maintaining hygiene around the tool also helps. And the third tip is double cleansing. So make sure that you're using an oil-based cleanser at night, first to remove the makeup, the sunscreen, and all the product buildup throughout the day. And then you use a water-based cleanser to further deep clean the pores. So these three tips can help in avoiding the acne related to makeup.
Fair enough. Doctor, I'm sure patient also asks you what to eat, what not to eat. So how important is diet? And in the beginning, you also said that maintaining a good lifestyle is equally
Wait,
important.
wait, I can't hear you. Hello?
Yeah, yes, doctor. Are you getting my voice?
I can hear you now.
Okay. So my question to you is what to eat, what not to eat? I mean, are there any dietary precautions and what kind of lifestyle we need to adopt to
So
take care of these
basically, there
activities?
are 3, 4 major acne triggers. One that we all know is sugar. When you consume products which are very high in glycemic index, it leads to release of a hormone known as IGF-1, insulin-like growth factor 1. That leads to further oil secretion and acne exacerbation. So one is limit the usage of high sugary content in your diet. Second is dairy. So dairy, basically, when we consume animal based milk products, it leads to, again, these cows are injected with growth hormones to increase the blood, what do you call, the milk production. And this growth hormone is not good for human body. It again leads to higher chances of inflammatory type of acne. The third is fatty food or processed food. When you have loads of maida, processed food, again it affects your gut health, and that leads to more acne causation. Fourth very common thing that we see in boys is excess use of whey protein, and this whey protein can also give rise to not just the face acne but also the truncal and the back acne. So
Right.
these 3, 4 things should be avoided. And in generally diet, a good balanced healthy diet which constitutes of 3 to 4 liters of water every day, around 6 to 8 to 10 nuts, soaked nuts, then 5 grams of seeds, chia seeds, flax seeds, green leafy vegetables, then green leafy vegetables especially with zinc, so kale, broccoli, spinach, then vitamin C rich foods such as amla or mossmi juices. These things are known to one, improve your acne, and also to reduce the chances of acne scarring.
Absolutely. We are getting so many questions from our viewers. I'll take them one by one. Pooja is here, and her question is: Doctor, suggest any acne cleanser for acne? Without taking names, if you can just tell us what things to look for in the cleanser.
Yes. So you can, if you have active acne, then you can look for ingredients such as salicylic acid and glycolic acid in your cleanser, and go for a foamy cleanser. Foaming cleanser would be better in the sense that it will not be very harsh on the skin. It is easy to apply. And if the skin is very dry, then you can start with a gentle cleanser and then eventually shift to a glycolic acid based cleanser.
Okay. Meenal Verma is here. Her question is: How does acne affect the skin's texture and blood flow?
Blood flow, it will not affect any which way, but the texture, acne will not cause a change in the texture. It's the scarring which will cause a textural skin. So if you have oily congested skin, you will have more visible open pores and the skin will look more textured. And when it heals, it leaves behind scars. There are 3 types of scars: ice pick scars, rolling scar, and box scar. That also leads to pitting and atrophy on the face. That leads to a contribution to a textured appearance.
Feroz Khan is here. Kirti is here. Kirti, her question is: are acne gels good for acne? Again, without naming the brands, do they really work, doctor?
Which, what did you ask?
Are acne gels good for acne? I'm sure she's
Acne.
talking about the, gels that is available, claiming that they will help to manage your acne.
Yes, so the gels are very, very effective depending on what ingredients they have. Gels alone in non-inflammatory acne are supposed to give very good results. So it is important that you get the correct diagnosis and let your dermatologist choose the active ingredient for you.
Mhm. Doctor, because we are continuously talking about acne management and how important it is to go to the right person, which is a qualified doctor in case, qualified dermatologist in case you have acne or any other skin related issue. Now, the thing is that, whatever procedures you spoke about, even the parlor wali auntie also claims to give those procedures, and people fall for it because, I mean, it's accessible or for
Accessible,
whatever reason.
right?
So, again, because a lot of people are watching this session, I'm sure they also get lured with, the proposals that are there from the Palavali Auntie saloons. Quackeries is equally increasing. So, why it is important to go to the right person, whatever we are talking from the beginning, that why we need to go to a qualified dermatologist to get the procedures done.
So, as I mentioned earlier, we are not afraid of the acne per se, we are more afraid of the acne scarring. And timely treatment, and that to a correct treatment, prevents you from getting eventual scars. The scar treatment is extremely difficult, and even the best of the lasers cannot give 100% improvement. So we want to treat the acne in a right manner and in the right stage, so that we don't end up with scars. And that is why these live sessions, the podcasts by proper dermatologists are important, because we try to educate the patient. And when you're once you're an educated customer, you will not be fooled by such proposals. So that's the hope.
Right. Dr. Veenu, before we sum up the whole session, any take home message for our viewers? Anything that you would like to tell? Do's or
Yes,
don'ts, maybe?
the most important thing is consistency. So acne is a long-term problem. Do not lose hope. Be consistent with your skincare routine. Do not change products very frequently. And one very common thing that I see in patients is that they were prescribed a retinol by a dermatologist and it gave them a rash. So they'll change the doctor. What I would suggest is go back to your primary physician, tell them that I have this issue, let them come up with the solution. Usually the solution is as simple as just, making the frequency a little less, using it only for short contact time. So your dermatologist will find the solution for you. Do not lose hope. Be consistent, and you will surely get the results.
So going to the doctor, to the right doctor, and trusting your
Yes,
doctor, it's equally important.
yes,
Just
equally
because you
important.
mentioned this, doctor, just one last question from my side, and that is, as you said, it's important to trust your doctor, follow your doctor, ask your doctor, etc. The problem is that many times, for example, I have a prescription, and which, for example, I'm your patient, and you gave me 3 months medication. I'll do it for 1.5 months, and because I'm seeing, improvement, I'll stop taking it without informing the doctor. I won't keep the doctor in loop, which is a very common tendency. People often do
Right,
this. Again, in case
right.
maybe after 3 months I'll see these acnes, then because I have the prescription, I'll go myself
I'll
to the
start.
chemist shop, the medicine,
Hmm,
and start
hmm,
feeling again.
hmm, hmm, hmm,
Is
hmm.
this a good thing, okay thing, or we need to follow the prescription?
See, if somebody has prescribed you an oral antibiotic or an oral retinoid, that is a strict no-no. The prescription should not be used beyond the prescription date. For example, I'd mentioned steroid abuse, right? So sometimes we have to prescribe steroids to a patient for, say, for example, we write it only for 7 days, but the patient will keep on using it beyond the prescribed date, and then they end up with side effects. So make sure that you know what ingredients are for what reason. Like, I like to educate all my clients, all my patients, that this is a steroid and should not be used for more than 3 days. And this is an antibiotic, should not be taken for more than 15 days. The creams you can still continue 15 days beyond the prescription date. So just be educated of what you're putting on the skin, read about the products, know yourself, and do not overstretch the prescription date.
Right. Thank you so very much, Dr. Veenu
You're
Jindal. It
welcome.
was wonderful talking to you. Thank you for sharing your insights. Your experience was very evident in this conversation, and it was a very informative and interesting session. Thank you
Thank
so
you.
very much once again.
Thank you.
Thank you, Doctor. And viewers, thank you for your excellent participation. Stay happy, stay healthy, take care of yourself, and have a great evening ahead. Goodbye.